He saved his life.
Saved my life, honestly, because at that time, the pain was so severe, and I was like, if this just continues, I mean,
That's all he
I'm
would
dying.
say. That's what he told me. He said, I'm dying. I'm slowly dying.
I honestly felt like that. I truly did. It's like, there was just no end to the pain. There was just no, I literally felt like I was dying. I mean, I just accepted that. I just accepted that, it was that bad. There was nothing else that worked. I mean, this has completely changed my life, saved my life, honestly. And, it's nothing short of a miracle.
Exactly.
Yeah.
Thank you.
Thank you.
Are you dealing with peripheral neuropathy that's affected and caused devastating pain in your feet, possibly across your whole body, the legs, the hands, face, back, neck, anywhere and everywhere in your body? If you're suffering from peripheral neuropathy, you deserve to listen to this patient and his mother, this patient's incredible recovery in a very short and pretty quick period of time, from incredible pain and going to doctors to incredible relief from pain. And as we go through this video, after this video, I'm going to actually make another video that I will put in showing the before and after of his functions, his original description, so you could actually see what you're going to hear from him right now of the kind of pain he suffered and the relief he's feeling right now, but also of his functions, and furthermore of before the first protocol, the first exam with me. And furthermore, we're going to reveal some of the exam findings of what it was that I discovered and treated him for. So, Mr. Can I say your first name?
Yes.
Joshua Peel, and your mother, Miss Peel. You're from West Virginia, right?
Yes.
And Mom, if I can, you found me online back a few months ago, right? You came to me, this is January 31st, 2019, and you originally came to me October 11th and October 12th of 2018. So we're talking about three and a half months ago. How you found me online, we'll talk about that in a moment, but how long were you suffering and how long were you watching him suffer with this incredible severe pain that was in the body and the feet?
Well, it started probably around February 2018, February, March, something like that.
Okay. And so with you, if we can describe the pain now, you can tell me everything you were telling me before this incredible recovery. Let's see, what was it like before?
Definitely a 10 on the scale.
And 10 is the worst.
10 is the worst. I mean, in tears, honestly, I didn't sleep. There was no sleep, just a constant pain, nerve pain, arms, legs, definitely the feet. You couldn't even touch my feet. The nerve pain was so bad. It felt like everything was amplified. Any touching, any physical pain was just amplified tenfold. And there was just no relief with anything. Nothing. Went to multiple doctors, was just prescribed Neurontin, and they told me it was just a side effect of my diabetes, which didn't really seem to make any sense to me. And so when the Neurontin didn't work, I was told to take more Neurontin, and there was just no end in sight. There was just no end to the pain. There was just no, I literally felt like I was dying. I mean, I just accepted that. I just accepted that, it was that bad. I mean, so.
The doctors that you had been to, where you started going to see different doctors starting around that February time of 2018, or did you live with the pain for a little while and then said finally you need to go to someone?
Yeah, in about April, finally just went to the family doctor, and that's when.
Did that doctor send you to another so-called specialist?
Yeah, a neurologist.
A neurologist. And that doctor said you have neuropathy?
Yes.
And were their tests run? Was it an MRI, a nerve conduction test, X-ray? They just said you've got neuropathy?
You've got neuropathy. No exams.
And here's the prescription for Neurontin right away?
Yes.
Exactly.
And did the Neurontin actually decrease it in even a fraction? Or was the pain the same, or did it actually make the pain worse with the Neurontin?
I felt like sometimes maybe, but a lot of the times it would actually make it worse. Like, I did notice it making it worse. And but at that point, I had nothing else. I didn't know what to do.
And how long did you see another doctor after that doctor who prescribed the Neurontin? Was there any other physician that you went to before you came to me?
Did I go?
Just the medical doctor.
Medical doctor and the
Endocrinologist.
yeah.
An endocrinologist, because with the diabetes, maybe, what do you think with the diabetes, there's something that maybe they
I thought they were connected, or I thought maybe
That's
there's
what
something that that's what I was told.
Mhm.
So
And did that doctor offer you any help, any advice, any recommendation or any kind?
psychological help was what I was told I need to go see.
He or she told you need psychological help.
Yeah.
Yes.
Wow. So you're just going to have to deal with the pain. Did they believe you had the pain, or they thought maybe it was in your head and you're just perceiving you had pain?
I don't.
Psychological help, that's horrible.
Yeah, I don't know if they believed I had the pain or just. I mean, I came in on a cane, and you have to remember I could not walk. I came on a cane, so I'd like to think they didn't think I was faking it, but I don't know if they just. I don't know if it's just what they're told is, well, they need to go see it.
Did you go to a psychologist?
I did not. I did not.
In addition to the endocrinologist, was there another type of doctor that you saw before you came to me? Was there an emergency room? Was there?
Yes.
Yeah.
Went to emergency room and
Only once or multiple times?
went once. At that point, again, it was just staying up nights with the pain. Didn't know what to do, so finally just I had her take me to the emergency room, and there, again, blood work was done, which is, I think, all they did. But at the end of the day, they told me I just needed to up my Neurontin. That was,
And to deal with it.
and I needed to deal with it better. Yeah.
You couldn't sleep at night?
I did not sleep, no.
You stayed up in pain?
In
You
pain.
stayed there in pain or
Constant pain.
A lot of tears.
Yeah, I would, I would take hot baths. I mean, it really wasn't a relief, but that was just to get away from the pain. I felt like that would help a little bit. So it was just constantly getting in a bathtub, just trying to, anything I could do to relieve it. I mean, there was no relief. Mm-hmm.
And when somebody would touch you, like you putting on, were you able to wear socks at all? Or was it more of a sandals?
Yes, sandals. Sandals is all I would wear. And even that was painful. I had to go through finding different sandals I could wear, soft heel, and I would walk. I was walking on the edge of my feet at that time, on the outer part of my feet. So, and after a while, my feet crawled like that. I just could not put any pressure down on my toes at all.
You're also going to see video footage of him trying to walk in my office here and outside my office. You'll see the real, intense, the pain that he had. But you're also going to notice, if you pay close attention to the way that he walked, his hands were curling in.
Yeah.
Wrists were curling in because the pain was just so excruciating with the pain in the body that you were just kind of bracing yourself. Was that?
Yeah, I probably didn't even notice it, but yeah, I was just everything. Everything was so sensitive. I mean, it was.
Well, he'd walked on his feet so long like this that's how they were forming.
Yeah.
And I said, you've got to try it, but he couldn't. He couldn't put his feet down.
No.
Put the feet down.
No.
Incredible. And you also told me that you felt as though, at least you started to tell me, and then he agreed that felt like his feet were, what did you say?
Cracking open.
Yeah.
They were just cracking open.
I don't know if it was the nerves or what, but there were times when I felt like the bottoms or the top, something was splitting open or cracking open. The nerve pain was so bad that I would actually check to see if it was bleeding or something. I mean, it was incredible.
And there was no bleeding. There was
No.
no kind of ulcers on the feet. You didn't have anything. like that.
Nothing.
Incredible.
Yeah.
Incredible.
Yeah.
That's just, it's almost speechless. It's just incredible.
It sure
Truly
is.
is.
Proud of recovery. And your aunt said it was, what you're all saying is, what did you say? All three of you came with your aunt today, your mom, and you were saying that's...
He saved his life.
Saved my life,
Saved his
honestly,
life.
because at that time, the pain was so severe, and I was like, if this just continues, I'm just...
That's all he
I'm
would
dying.
say. That's what he told me. He said, I'm dying. I'm slowly dying.
Honestly felt like that. I truly did.
Pretty incredible.
It is.
Very incredible.
Yeah.
Very.
I'm super happy.
Oh, yes. yes.
It's
Beyond.
We
yeah.
sure are.
Yeah. Thank you very much
Incredible.
for sharing this.
Oh, thank you.
Yeah, you're welcome. And,
Yes.
and one more time, the pain was throughout the body was burning? Sharp, dull, stabbing, tingling.
All of it.
All of that.
So, yeah, all of it.
Constant, and it was just, the burning pain was so bad in my arms that I would have like compression wraps around my arms constantly, on my feet, anything I could get. Those socks that you put on that.
Compression socks.
Yes, compression socks.
Did those aid you at all? How'd you even get those on with the pain?
I couldn't get them over my feet, so I would at first I would wrap them around anything.
It was a struggle.
It was an incredible struggle. I mean, there was no. It really wasn't that much of a relief. I just needed anything. It was just terrible pain. Terrible. Yeah.
Awesome.
Yeah.
And the relief is right now the pain is
there's no pain.
Gone.
There's no pain.
And you're walking just about 100% normal.
Yes.
Now.
Yes.
And everybody around you can see it and knows.
Yes.
Absolutely.
And now people can brush up against you or touch you or hug you or shake your hand, and there's no pain.
No pain.
No pain.
No pain.
Zero.
It's
One visit.
It's incredible.
One
It's amazing.
Yes.
It's amazing.
Yes, it's very amazing.
Stay tuned for the rest of the video. I'm going to show you before and after with him walking. Even his conversation with me when I first met him, you're going to see him in that state of how bad he was. And you're okay with me
Yes.
sharing that interview that we had?
For sure.
And then I'm going to share the next video, which will be some exam findings and help you understand. And I can help you too. I really believe that we can get the job done. It was so intense. One more thing before we end this video, and we may include this or not. Have your blood sugars changed? So you've been looking at that. Is there any difference in the blood sugar level or?
I'm not
or
taking
medicines?
as much insulin.
You're not.
No.
Have you changed your diet?
Yes. To what you recommended. Yes.
And so with the insulin amount reduction, what was the amount or average range that you were using in a 24-hour period of how many units? You used two different. Which ones have you been using, and what do you use?
I use a long-acting insulin.
Which is
Toujeo.
Toujeo, and the other one is?
Just the Novolog.
Novolog. So how many units of Novolog were you before we started? In a 24-hour period, one day?
Maybe 30. Something.
No, she started you out 30 with the long, or 36.
No, I know, but the Novolog, I would take 8, before meal, 8 and lunch, and then if snacks 4. So maybe 30, 40.
40.
Probably 40. Probably 40 a day.
40 a day of the fast acting.
Yes.
And how much of the long acting?
30.
So 70 units a day was an average for you.
Yes.
70 in 24-hour period.
70, yeah.
And so what is it now?
35 to 40.
Total between both?
Between both.
So if it was 8 a meal, what are you using per meal now?
Sometimes depending on what I eat, I won't even take the Novolog. I won't even eat the Novolog.
And at night, and the long-acting one is, still would have to take?
I still take the long-acting.
I'm saying if you don't take it per meal of the fast-acting, but the long-acting one is decreased to, it's even still less than?
It's a little bit less, yeah.
It's a little bit less.
Yes.
So,
yeah.
And your blood sugar levels, have you had another blood test since we started this? Any medical laboratory blood test?
No, not yet. I've got the monitor.
And so what are you averaging in after meals or waking up in the morning? What's the average? If you're not having to take it per meal like you used to on certain days,
right.
You actually not had to use, let's say that again, tell people listening, because there are a lot of doubters out there that can actually help people improve with their function, especially with type 1.
Yes.
Type 1. And you've been type 1 for how long?
Since diagnosed in April. Yes, 2018, yes.
Okay, so your decrease, and this is not a honeymoon period, we're getting the job done, pinpointing and removing safely the infections and toxins causing the problem, causing the conditions, plural, including diabetes. So you have now decreased your insulin by probably about half
around
in a whole day.
Yes.
And what are your blood sugar levels after a meal, let's say in 30 minutes or an hour after a meal when you take your blood sugar? What is it going up to?
It stays at about 140, 120. Yeah, I mean it stays pretty.
And an average waking up in the morning, what is it? Before you have anything in the morning?
About 100.
100.
Yeah.
Wow.
Yeah.
That's incredible.
Yeah.
Yes.
What was it before we started when you woke up in the morning? Do you remember? Before you ever came here, what was it?
Yeah, it would get up to 116. I could just see it creeping up to 200 of the morning. Yeah.
No, not happening. That's not happening.
No.
Pretty amazing.
Yeah.
Really life-saving, really
Yes.
life-changing.
Yes.
Pretty awesome.
Yes.
Thank you both for sharing this. If there's anything else, you can just say it now. You can tell the world if there's anything else that you want to share. And if not, I'm going to put other videos in with this of his before discussion and my description of what I found.
There was nothing else that worked. I mean, this has completely changed my life, saved my life, honestly. And yeah, it's
Exactly.
nothing short of a miracle.
Exactly.
Yeah.
Thank you. Okay.
Thank you.
Thank you. Thank you.